Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
AG is a 51-year-old female patient who is being managed for a variety of mental health conditions, including bipolar disorder, opioid use disorder, generalized anxiety disorder, and adjustment disorder. Her medication regimen includes a buprenorphine-based medication for opioid use disorder, an antipsychotic, an SSRI, and an antihistamine. The physical examination documentation for each patient encounter should include A and. So there's no hint here, A or an. What should the physical examination documentation include with each encounter? A PHQ-9, an Ames score, a GAD-7, or an ORT. So you don't have to memorize all of these different initials for each thing. I put them here for the sake of brevity, but we're going to go over each one because there is really just one concept in this question that's most important to take away from our podcast. And that is, well, let's look at the answer first and we'll talk about why. Again, the question is, the physical examination documentation for each encounter should include A, and the answer is B. B, the correct answer is the abnormal involuntary movement score, also known as the Ames score. The Ames score should be documented as part of the physical exam for each visit when a patient is on an antipsychotic. Now, I live in the real world, and I know that that doesn't always happen, but it should. And it's a really good habit to get into when you are establishing your practice. It's easy to do. It doesn't take a lot of time. You can download the Ames, the questions from the Ames screening tool, have them readily available, and you're seeing your patient and just do a simple point assessment. But the abnormal involuntary movement scale is exactly that. It's an assessment of involuntary movements that can occur in patients on antipsychotics. It's quick and it's an important physical observation with anyone on an antipsychotic. And a best practices approach is that it's done every time you see the patient. That's why it's the best answer. It's very specific to the question. The question says the physical exam documentation for each encounter should include. And the answer is that for every physical examination you do for a patient on an antipsychotic, you should document an Ames score. The PHQ-9, you're probably familiar with. This is a depression screening tool. And while it certainly may be helpful when you are initially evaluating a patient, and it may be valuable intermittently as you're trying to follow their progress on antidepressant therapy, it's certainly not something that needs to be done at every visit. And it's not an assessment of physical examination. Remember, physical examination are those objective findings that you can observe or measure when you see a patient, like the presence or absence of abnormal movements. A PHQ-9 is really more of a subjective symptom assessment. How does the patient feel? How often do they feel that way? You can't really observe the phenomenon from a PHQ-9. It's the patient's interpretation. But most importantly, it doesn't need to be done at every visit. An Ames score should be performed at every visit. Similarly, the GAD-7, generalized anxiety disorder 7, is again another screening tool. We use it to screen people for generalized anxiety disorder, and it's certainly a useful tool in your early assessments. And just like the PHQ-9, it might be useful as you are following patients along their course of therapy, evaluating their response to care. Sometimes it's really helpful when you first see a new patient and they have a real problem with anxiety and their GAD score, let's say, is 20. You put them on medication, you get them on a plan of care, they come back and follow up and say, I don't know, I'm not really feeling any better. And you do that GAD score and find out it's 10. they've improved by 50%. And you can measure that objectively. So the PHQ-9, the GAD score, they certainly are both useful tools, both early on and intermittently, but neither of them are necessary at every visit, and neither of them are physical examination tools. They are symptom assessments. And then finally, the ORT is an opioid risk tool, and this is a tool that can be valuable in patients when you are considering beginning opioid therapy and you want to make an assessment of their risk. Are they somebody who's at risk for an overdose? Or are they at risk for developing a use disorder? That's what the opioid risk tool is for. But this patient already has a known documented diagnosis of opioid use disorder, and she's being treated for it. So the ORT isn't something we use to follow the course of therapy for that patient. And so, for all of those reasons, B is hands down the only correct answer for this question. But you can be distracted. Don't be fooled. It's easy to find yourself going off with the things you're more familiar with, the PHQ-9, the GAD-7. But as always, remember to answer the question that is asked of you. And the question is, the physical examination documentation for each encounter should include, and for every patient on an antipsychotic, the physical examination documentation should include an Ames score.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit fhea.com.